A 13-year-old patient reported to the Department of Paediatric and Preventive Dentistry with a chief complaint of caries in lower first permanent molar. There were occlusal caries that were involving enamel dentine and requiring composite restoration. The tooth is isolated under a rubber dam and the caries is completely excavated with round diamond burr. The cavity is now clean and ready to receive the composite restoration. The tooth is then etched with 37% phosphoric acid gel for 20 seconds. After that, the gel is washed with copious amount of water and the tooth is air dried. This is then followed by application of the bonding agent with an applicator tip. The tooth is then gently dried and light cured for 20 seconds. Thereafter, flowable composite resin is applied to the floor of the cavity and light cured for 40 seconds. Following this, packable composite is applied in layers and cured in increments for 20 seconds each, giving the desired form of restoration required. The occlusal anatomy is enhanced by using occlusal prints. The restoration is then checked for any high points with articulating paper. Thereafter, polishing is done and the occlusion is evaluated and the procedure is completed.